Yes.
Good morning and welcome to the COVID-19 Vaccine LinkedIn Live event presented by Kent County Health Department and Spectrum Health. Hi, my name is Lisa Hunter and I will be your host and moderator this morning. For our agenda this morning, we are going to be covering two major topics. We will be covering COVID-19 as it relates to the current infection rates, hospitalization, and also regarding the various testing that is going on. Secondly, we will be covering everything related to the COVID-19 vaccine. We know it's very exciting, and we want to make sure that you have the education behind the Moderna and Pfizer vaccines, along with the rollout plans. Lastly, we'll make sure that we leave room for questions and answers because we know there are many. Let me also now introduce you to our presenting experts. First, we have Keith Hostak. He is Vice President of Virtual Health, Employee Health, and Occupational Health Services. He also has a distinct accomplishment to his name of leading the very first drive-up test site in Michigan. Next, we have Dr. Joel Lopez, Spectrum Health Division Chief, Urgent Care, Occupational Health, and Virtual Health. He has also transformed our urgent care, allowing us to be able to do from car to room, and also curbside vaccinations. And we have Brian Hartle, a epidemiologist from Kent County Health Department, and he has been head of surveillance for COVID-19 for Kent County. Welcome, gentlemen, and thank you for being here. I'm going to turn it over to Keith Hostak.
Yeah, thank you, Lisa. And today is certainly an exciting day. If you guys recall, if you were here in the spring, we did a similar kind of LinkedIn Live event. And at the time, we were talking about testing, and COVID was still new, and we had a lot of questions that were going unanswered. Now it's exciting that we have an answer, and the answer is vaccine. And I kind of liken this to going on if you're playing in a sporting contest. Instead of being on defense all the time, which we've been, right, retreating to our homes, staying away from people, washing hands and masking, which still is very important, obviously. But now for the first time, we can go on offense, and that's the vaccine, because the vaccine can actually eradicate this disease, especially if we get our vaccination rates up, which we'll certainly go into here. I'm also happy to be joined by Brian and Joel, my esteemed colleagues.
That's great, thank you. And I will turn it over to Brian to kick us off regarding COVID-19 current situation.
Well, good morning, everybody. So my job is kind of lay the groundwork here about COVID data, both nationally as well as locally. So my first slide here, Mike, if you want to put that up there. Next slide, I guess. There we go. All right, thanks, Mike. So I just wanted to start off with kind of showing where the United States stands with regard to other countries and how we compare. And obviously from this graph, you see that we lead the country in daily numbers of cases by a large margin. Here in the States, the case numbers really started to rise in late November and kind of kept on climbing through the end of the year. We did see a little bit of a decline at the end of the year, but we did see evidence of a post-holiday spike. A lot of warning signs were out there about travel and gathering over the holidays, and we have seen that occur in terms of more case numbers over the past couple of weeks. Fortunately, we've been seeing a little bit of a decline over the past few days, and that's largely due to some of the bigger states in the nation, like California, who had a large number of cases, but have seen those case numbers stabilize a little bit over the past few days. So that's encouraging, but we'll kind of see how things go on from there. A lot of what you've heard lately is about the variant strain of COVID-19 called B.1.1.7 that emerged in September in the United Kingdom. As of yesterday, 20 states in the country have identified at least one case of this strain in cases of COVID-19 in their states, including Michigan. Over the weekend, the news came out that there was a patient from Washtenaw County who had traveled to the UK and has been identified as having this variant strain. We don't really know what's going to happen in the future. We do know that this strain from epidemiological studies has shown a greater ability to transmit from person to person. We haven't seen it cause more serious infections in people or more serious consequences from the disease. And we've also not seen it potentially be able to evade the vaccine. So that's good news. So we can't really predict what's going to happen here in the future, but with the vaccine rolling out, we hope that these numbers and these declines in our daily numbers will continue to see that. Next slide, please. So the deaths, this is the biggest thing that's concerning for us, is the numbers of deaths that we see on a daily basis in the United States. So just this morning, the United States has eclipsed 400,000 total deaths in patients who are diagnosed with COVID-19. And usually deaths are a lagging indicator because people who have COVID-19 are diagnosed and then they don't die from the disease, for, several weeks after. So that's why we saw a decline in the numbers of cases on a daily basis, but we're still seeing increases in our numbers of death on a daily basis. So deaths really started to climb again in early December in the United States, and they continue to climb. And lately, we've been seeing about 3,000 to 4,000 total deaths each day here in the States. Next slide. Here in Michigan, we're seeing a similar trend in terms of increases in our cases. We saw the increases start kind of the same time, late October, early November. It really peaked, kind of around Thanksgiving time. And it's fallen off, similar to the United States. And towards the end of the year, we saw that decline in the number of cases. And we did see a little bit of a blip as the post-holiday, kind of travel and gatherings occurred. But now we're still continuing to see declines in the numbers of cases. So we're down below 4,000 cases per day. And the most recent numbers, I think as of yesterday, we just had over 2,000 cases. And so here in Michigan, we're doing pretty well and seeing those numbers continue to decline. Next slide, please. So the epidemic order that was put in place in Michigan on November 18th really looks at 3 different indicators of when we can kind of look to reopen restaurants and things like that. And so the first indicator is the positivity percentage, which is the percentage of people who have a test that come back positive, the daily case rates per million population, and the hospitalization rates. And from these 3 graphs here, you can kind of see around the time that the epidemic order was put in place on November 18th, we're kind of at a peak level of all of these indicators. And since then, they plateaued and declined somewhat. So those are good signs. And, we've heard that the governor is looking to potentially reopen restaurants around February 1st. So if these numbers continue to decline, these indicators continue to show progress, we can hopefully be at that state come February 1st. The map here on the right just kind of shows different indicators by region, and we're seeing the majority of the highest indicators in the South Central and I guess the Thumb area or Saginaw Bay area. Those are the areas that we're seeing these indicators be at their peak in the most recent data. So areas 3, 5, 7, and 4 is where in Michigan we're seeing these indicators at their highest. Next slide, please. Just want to look at the demographics a little bit of our cases over time. And as you see from this graph, early on in the pandemic in Michigan, we saw a lot of our cases in our older adults, so 70 years of age and older. Most of that was due to the fact that we had a lot of outbreaks in our long-term care facilities and congregate living care facilities. So we saw a lot of patients in that population become infected. Once the stay-at-home order was lifted about the 1st of June, we kind of see those rates level out in terms of age groups. But in this most recent rise in cases, we really saw the case rates in our 30 to 49-year-olds and our 50 to 69-year-olds really drive that. So those are the people who are working. They're the ones out and about making the majority of our workforce. And so those individuals have been kind of the drivers of the infections most recently in this latest spike. Next slide, please. In terms of race and ethnicity, you know, those numbers really there was a lot of disparities early on in the pandemic as well. And you'll see in the middle, in the summer months, those kind of leveled off as well. Early on in the pandemic, there was a lot of issues with social determinants of health, housing, transportation, and employment. What we did see early on was that a lot of individuals who were becoming infected in our racial and ethnic populations were engaged in work that you know, they were essential workforce, you know, food processing, manufacturing, other things that, you know, factory work, where maybe there wasn't the greatest precautions taking place for social distancing measures. So once those, you know, companies were able to kind of learn from their mistakes, get better precautions in place, we saw those declines in those populations. And recently, with this I'm sorry, I'm seeing maybe some people that are having a difficulty joining. So I'm going to continue until I hear otherwise. But most recently, in the recent rise in cases, we see that the white population had higher rates of infection until most recently where they have leveled off again. Next slide, please. Despite, you know, it's kind of the leveling off of cases by race and ethnicity, we do see that the Latinx population in Michigan overall has been disproportionately affected by the COVID-19 pandemic. As you can see here from the slide, despite just, you know, the early parts of the pandemic, rates in our Latinx population have been higher than the non-Hispanic or non-Latino populations. Next slide. So ICU, that's one of the biggest things here we keep an eye on in terms of the severity of the illnesses that we're seeing. So this graph just kind of shows the number of individuals in the intensive care units across Michigan over the course of the last several months. And as you can see, the trend is similar to what we saw in the case numbers, where in November we had large numbers of populations in our ICUs, and our healthcare workers and our hospital staff were burdened greatly by that. And luckily, fortunately, over the past few weeks, we've seen those numbers fall off a little bit and to relieve some of that burden on hospital staff, and shows that the severity of our infections aren't quite as high, or the numbers aren't quite as high in recent weeks. And the table on the right just shows kind of regions and where ICUs are more populated, where the ICU occupancy is higher. And we can see the western part of the state, you know, has lower ICU occupancy than sections of our eastern half of the state. And so as far as Spectrum Health goes, and Western Michigan, you know, we're doing pretty well in the most recent reports in terms of the capacity that we have in our ICUs. Next slide. Now this slide looks at outbreaks, and the CDC defines an outbreak of COVID-19 as 2 or more individuals who are, you know, related by you know, place of work, by school that they attend. The health department, Kent County Health Department, has a team that works closely with employers to investigate cases of COVID-19 in their workplaces, and to determine, you know, whether those cases are linked up, if they're, you know, individuals who may have worked closely together, worked the same shifts and things like that. So outbreaks are defined as 2 or more cases within a 2-week period. And as you can see from this graph, you know, long-term care facilities, skilled nursing facilities, assisted living are by far and away the highest number of outbreaks that we have across the state. I'm going to take a pause right now. It sounds like we need to maybe try to let some people in. So I'm going to take a break for a minute.
For everything, technology challenge. We understand that some people are not able to either hear or to join. So Mike, I'll ask that you step in here and advise if there's any more advice, but please go to the Spectrum Health LinkedIn company page, and you should be able to view the broadcast from there. Or you can also watch on either Twitter, so be twitter.com/spectrumhealth.org, or YouTube at Spectrum Health. So youtube.com/Spectrum Health. So my apologies. Oops, not org. What is it, Mike? Just .or. All right. So for twitter.com/spectrumhealth.or. All right, thank you. Sorry about that, Brian.
No problem. Ready to go back?
Let's give people just one more minute to be able to join us because you have a lot of great information you're sharing. Let me see. I'm gonna check the comments here just to see. And I see if you haven't seen the comment there, we will be posting, this is being recorded. We will be posting this not only on our channel or on the LinkedIn channel for Spectrum Health, but we will also have it on our employer resources at spectrumhealth.org/employers resource, in case you want to go back and see, here's some of this information. All right, we're going to go ahead and keep going. Turning it back to you, Brian. Thank you.
Thanks, Lisa. The long-term care facilities, that it involves both residents of those facilities as well as employees. But when we just talk about employees and employee-related outbreaks, manufacturing and construction is one of the areas that we, especially in Kent County, we've seen a lot of employers who are involved in manufacturing construction trades, where we've seen several outbreaks in those facilities, food processing, office settings, and restaurants where employees are in close contact with each other in the kitchen, and we've seen outbreaks occur in those facilities. As I mentioned before, we do investigations of these facilities, and the things that we notice the most are just the way that people work together. Sometimes people aren't able to social distance as well if they're working on a project together in a manufacturing site or construction site, working in the kitchen. Those things lead to transmission within those facilities. Also, break rooms and lunchrooms are a big part of infection transmission. So, people go into a break room, they don't mask, and they're eating and they're close together. So those are some areas that we often find as potential areas for transmission, when we do these investigations. Trainings as well. Some people, are still doing trainings where they, gather in a conference room or travel to a training together in a car, and we do see some outbreaks occur related to those activities. Next slide, please. So this is just a slide of Michigan deaths. We kind of see that, two peaks early on in the pandemic when we saw a lot of our long-term care facility residents, pass away from the infection, and then here recently where we see, kind of a wider spread there where deaths are occurring over a longer period of time. Next slide. So just getting into Kent County a little bit here locally, these are our numbers of cases by day here in Kent, and the trend is very similar. We've seen the numbers come down at the end of the year, that little spike after the holidays, not as much as we thought it would be. So that was good. We're glad to see that. And really the last couple of days here in Kent, we've not had many cases at all. These data were put up there a couple of days ago, but yesterday we had 61 cases reported to us. The day before that, we had 100 cases reported to us, and you can see that's bringing that trend line down even further from what's here listed here. So that's great news for us. We're hopeful that the vaccine is having an effect. We're hoping that all the precautions that people are taking is having an effect on limiting the numbers of cases here we're seeing on a daily basis. So we'll keep our fingers crossed that these trends will continue. Next slide. Just a little bit about the demographics here locally. Really, we're seeing the same thing with our Latinx community, where they're disproportionately affected. About 16% of our total cases are in our Latinx community, and about 10% of our total population is from that community. And really seeing that same age group distribution, 19 to 44, really is the peak level of infections in our community for COVID-19. And based upon demographics and race and ethnicity, the cases in our racial and ethnic populations, African American and Latinx communities, are slightly younger than the total number, or the total population. Next slide. Running behind a little bit, so I'm going to go through. I'll skip this one because it's a similar trend that we saw statewide. Our deaths were a little bit different here in Kent County. So we had 170 deaths occur in the month of November, which was more than we had in the months of March, April, and May combined. So we kind of saw similar case numbers in the state, or death numbers in the state, from early on in the pandemic to most recently. But here in Kent, we really saw the bulk of our deaths occur in this most recent rise in cases. Next slide. And just that's, I think the biggest takeaway from this is disparities in age at which people pass away in the different demographic groups. African American males, the average age at death is 68. The Hispanic community, both males and females, are in their 60s, the average age of death. So these individuals in our racial and ethnic populations are losing many years of life from COVID-19 deaths. I mean, even though the numbers might be similar, in terms of total deaths, really, people are being robbed of years of life in our racial and ethnic populations due to this disease. Next slide. This is just our dashboard. If you have more needs for more data, you can always go to accesskent.com and search our dashboard. So we can move on to the next slide. I think I just wanted to finish off here with different types of testing. So there's really 3 different types of testing. There's molecular tests, antigen tests, and antibody tests. Molecular tests and antigen tests are both diagnostic. So those are going to be able to identify active infection in an individual. A serology test, an antibody test, is only going to show whether or not you were infected with COVID-19 in the past. It's not going to diagnose you with COVID-19 currently. So these tests are readily available. The antigen test is a little bit less sensitive, and sometimes it shows false positive results. The PCR test, or the nucleic acid amplification test, the molecular test, is kind of the gold standard. So sometimes if you do have an antigen test that's positive or negative, sometimes you will be asked to do a PCR test as that gold standard. Usually, if people have a positive antigen test and have symptoms of COVID-19, we really take that as a positive test and going to treat them as a case and not have them do another PCR test. But the antigen test is used for screening. A lot of employees use this, nursing homes use this, but we will, sometimes, like I said, request an additional test done if the patient is asymptomatic. Next slide. Just finish up here with some numbers. You can kind of see the testing numbers here in Kent County as well as across the state. During the peak of the pandemic in November, we saw about 5,000 tests per day here in Kent, about 50,000 tests per day in Michigan. And you can kind of see the percentage breakdown there. About 10 million cases almost, or 10 million tests have been done in the state of Michigan. Most of those are those diagnostic or molecular tests, and only about 5%, both here in Kent County and across the state, have been the serology or antibody test. Next slide. Finally, the positivity rate here in Kent, I guess, this is the thing we look at. During the peak, we saw about 20% of people being tested come back positive. Lately, we've been seeing about, anywhere from 8 to about 8% of tests, and we hope that continues to go down. Like I said before, the vaccine gives us hope, and that's what we're going to talk about next. I'm going to turn it over to Keith to talk about the vaccine.
Actually, I think we're going to go to Joel first.
Oh, sorry, Joel.
Yep.
Thanks, Brian. Yeah, so similar from a positivity rate here at Spectrum, our most recent 7-day average is 8.8%. So just talking about the COVID vaccine, one of the things that I want to just go through with you is high level some of the types that are available, then specifically the science behind how vaccines work. I know Keith talked about us previously being on defense, and the vaccine is our chance to be on offense. So again, talk about the science of how vaccines work. Then talk about the dosing or the series of the actual vaccines, and that's associated with the Pfizer and Moderna vaccine. Then we'll go high level through side effects, and I apologize in advance that there's a little bit of an eye chart for one of the images there, but I'll try to direct you through that. And then we'll go through a couple of the myths that you maybe have heard from friends or seen in other places. So if we go to the next slide, what I want to talk about are the 2 that are available within the United States today. So obviously we're here mid-January, and what we have available in the United States from an FDA approval is the Pfizer, BioNTech, and Moderna. Obviously there's significant interest in creating vaccines, and up as of right now, there's around 60 different manufacturers that are creating different vaccines other than the 2 that I just mentioned. So those 60 are in various phases of clinical trials. So whether it's phase 1 through 3. And so you might have heard about other vaccines such as Johnson & Johnson or the UK study, the AstraZeneca. So again, I'm going to try to focus on the 2 that are available today. But as we learn more, there'll there'll be additional details. So if we move to the next slide, just to talk now about vaccines. So vaccines, just regardless of what we're trying to treat, but the analogy I'd like to use is the vaccines are the practice test before the exam. So you can kind of study, you can prepare and really teach your immune system or your body what to be ready for. So in the categorization of vaccines, we use weakened live particles or weakened viruses. And an example of that would be measles. Then we use dead particles, and an example of that would be influenza. And then a new category is using messenger RNA or mRNA, and that's associated with the COVID vaccine. So this is not associated to your DNA, but really I use this image here on the side. It's the vaccine is giving your body an order to make proteins or make antibodies towards COVID vaccine. So if we move to the next slide, then talking about the timing. So Pfizer and Moderna, they both need 2 doses. Pfizer dose 1 and 2 is separated by 21 days, and Moderna is separated by 28 days. The reasoning for getting the second dose is really what I want to use this image below. And so this image comes from the New England Journal of Medicine that was specifically talking about the efficacy of the Pfizer vaccine. So the data is similar for the Moderna, but really what I want to highlight your eyes to on this chart are kind of 2 parts. If we look at the upper left box, you'll see a red line and a blue line. So the red line is the individuals within the study who received the vaccine, and the blue line is the placebo group. On the y-axis or kind of vertical part, it shows the incidence of disease, and then on the x-axis or horizontal, that is a timeline of days. So it takes time for your body to practice and kind of build up these antibodies. So if you kind of move from left to right, the red line and blue line trace very similar, but then over time, then they start to separate. So meaning the people that did receive the vaccine in this trial ended up having a lower incidence of disease, or more or less was showing they were able to be protected against exposure to COVID and really picking that up. And then if I bring your eyes down to the bottom part of that graph, you'll see as time progresses, that difference increases even greater. And so the study for Pfizer and Moderna, they gave a second dose around the 21 to 28 day mark because of the fact that they wanted your body to have a second practice test, for lack of a better word, or to really build up a strong immunity towards the COVID spike proteins, or the part that's really entering your body. So if we move into the next slide, just to talk about side effects. So this is, again, the eye chart that I was mentioning. The graph here breaks up the study participants into kind of 2 different parts. So one is to try to show the side effect profile on the left-hand side at the site of the injection, or kind of localized reactions. And on the right side is then more systemic or full body. So the common thing that you'll see, that biggest bar graph, and each bar graph is associated with the people that actually got the vaccine, as well as then the placebo group. So you'll see on the left-hand side, the most common side effects that you're going to see are really pain, swelling, and then localized redness. And they score these on severity. So if you're not seeing orange, that's great. So meaning the majority of the people that communicated that they had these symptoms felt that it was really mild or moderate, so the green or blue. If we then move to the right side of that chart, this is then the systemic, or kind of the rest of your body kind of symptoms. And so those symptoms that were reported were fevers, chills, fatigue, headache. And so these are really common. It's not unique to the COVID vaccine. These are common reactions when your body is building up immunity. And the part that I think is important to note is if we look at the top part, that on the right-hand side, again, there's the placebo group as well as then the group that received the vaccine. And so the placebo group did not receive any of the actual medicine or the vaccine, but they still communicated that they had fatigue at a kind of similar rate. So you're this, but they're known, and you're not really seeing orange or even the red on this graph. So if we move to the next slide, I just want to cover through high level 5 different myths. And if you guys have other ones, feel free to put those, in the chat, or, communicate near the end. But one of the questions that is often asked, because of the fact that this vaccine came out so quickly, that it's not an FDA approved vaccine. And so that is false. Both the Pfizer and Moderna, they moved through 3 phases of clinical trials, and those did include human clinical trials. Then independent experts reviewed the data from these studies and then gave a recommendation to the FDA. And then the FDA themselves reviewed the data and then authorized use. So it is an FDA approved vaccine. The second myth that's kind of brought up is this disease, COVID, really only affects adults, so children don't need to get it. And so that's not true. Obviously, children have had this disease and then unfortunately have had impact from that. But the study for the Pfizer and Moderna vaccine did not include participants less than the age of 16. And so at this time, you have to be age 16 or greater to receive those vaccines. So moving to the third myth, after getting the vaccine, I don't have to wear a mask. And so the important piece to understand is that what's not known from the vaccine is whether or not you can still carry or transmit it to other people. So yes, the vaccine is going to protect you on an individual basis, but really the importance of those best practices from infection prevention, like wearing the mask, social distancing, washing your hands, is not just to keep yourself safe, but also to protect other people. So that is a myth. And then I think this one is really common for people that have had vaccines and unfortunately had side effects to different vaccines or different concerns, is about the allergy profile. So one of the myths is I can't get the COVID vaccine because I'm allergic to eggs, or I have an ethical or religious belief that opposes the use of fetal tissue. So really important to know is that neither the Pfizer or the Moderna vaccine used eggs or fetal tissue in the development or production of the vaccine. So really, those should not be barriers. And then the last myth is that, and this one, is more kind of like swirl, or from the standpoint of, social media drama, is that the COVID vaccine was developed to control the general population, putting microchips or neurotransmitters, and this is absolutely false. I know a lot of this is based off of comments maybe Bill Gates has made, and really it was talking about a passport that's not based off of your body, but just in general being able to communicate your vaccine. So I'm sure you guys have other questions or myths, but I want to pass it to Keith to talk about the vaccine distribution and specifically what we're doing here in Michigan.
Great. Thank you, Joel and Brian. If I can just quickly review, I think we saw, from Brian that, how deadly this disease can be and how fast it really can spread. Also, some of the racial disparities that we've seen. And then from Joel, great talk on, some of those myths of vaccine. Again, this is the answer. And for all of those who are wondering, should I mandate the vaccine? Should I not mandate the vaccine? I hope for the most part you really paid attention to what Joel was saying, because at the end of the day, the evidence is very, very clear that this vaccine certainly is efficacious against this disease, and the side effects are nowhere near the harmful things it can do to your body if you don't do a vaccine, as what Brian was saying. So I know all of you are probably wondering, this is all great, Keith, but we really want to know, when am I going to get my vaccine? And so that's what I'm here to kind of talk about and kind of walk through. And just know, first and foremost, this is a very fluid situation. There really is a couple different factors that we have to kind of consider. First of all, what is the demand? So how many people do want the vaccine? How many doses are we going to get of the vaccine? What's the delivery method then like, in terms of getting the doses out to you guys, and the staffing that we would need, et cetera? So those are all factors that we have to kind of consider. As you can see, I have on the slide here, this first slide, kind of the latest in terms of our vaccine timeline. And what you'll notice here is it's kind of broken down into phases. We certainly are in what's called phase 1B. So there was phase 1A, and then there was different parts of phase 1A, and then there's phase 1B. So that means Michiganders age 65 and older, frontline essential workers, childcare, pre-K through high school staff, and congregate care facilities. We still, however, are working through phase 1A, which is all of our healthcare workers and long-term care residents. So many of you are probably thinking, well, why is that? Well, as we've seen, getting vaccines certainly has been, in terms of getting from the federal government, then from the state, kind of getting all those kind of processes organized, certainly has its challenges. But what I'm happy to report is that we are getting more vaccine, and just like I think Spectrum, especially, and our partners with Kent County, we really are on top of testing, and I can just project that confidence that we're really on top of vaccine also. The goal here is to vaccinate about 70% of our adults. And that gets that magical term, that herd immunity, which just means that we have more people vaccinated than not vaccinated. And then what you'll see is the rates of the infections kind of go down. And I think Joel really had a nice slide that kind of showed that during the studies. Next slide, please. So a little more details on this phase 1B. So we are in that phase 1B, 65 plus, law enforcement, prison, school, child care. You can see here, I have a kind of a snapshot of instructions to get vaccination. All health systems are using what's called MyChart. MyChart is an app that we have through our Epic functionality. Epic is our electronic health record. But Metro, Mercy, and Spectrum all have this kind of functionality. And so that's how you can sign up for it individually, which I'll get into here more in a second. The other thing I want to mention is people are saying, well, Michigan really is just falling behind in terms of getting vaccine out. I've heard other states are doing just so well. And let's talk about that for a second. Michigan is kind of right in the middle. So they took basically the top states of who's getting vaccine out. And Tennessee was at the top, and they're vaccinating at a rate about 3.9%. Michigan is in the middle, so we're at that 2.9%. At the bottom is Georgia, and they're 1.9%. So just notice that we're all kind of in this similar phase of within a percentage point of rollout. So this is coming again from kind of federal, then to the state, and then it gets to our health departments and health systems. Next slide, please. Now, here is a great shot of kind of, at least from a Spectrum perspective, the different clinics that we are offering and that we're ramping up. You can see that we have about 9 clinics there. You can see also that through the week of January 18th, we've done 3,000 first dose and then 5,359 second dose slots. But here's what I want to say about this. As tricky as everything is in terms of not knowing how much vaccine is coming yet and what we're going to be able to ramp up to, we certainly have goals to ramp up to 50,000 doses a week. And that might seem like a gaudy goal, and it might seem like bold, but just like we saw with testing, I think our efforts are going to be even tenfold with vaccine. And it's because, as I keep saying, vaccine is the answer. Vaccine is going to allow us then eventually someday to take these masks off and go to sporting events and watch our kids play sports or go to concerts, etc. And so that's why, at Spectrum and at Kent County and through our West Michigan Collaborative, which I'll talk about in a second, we really are going to go all in on vaccine here. Next slide, please. Okay, so couple things I want to say on this slide. You can see a picture of the no pun intended, a picture of the actual vaccine itself. But then you can also see a couple different things here. I really want to promote the Vaccinate West Michigan Collaborative. So what is that? The Vaccinate West Michigan Collaborative is basically a collaborative between the 3 major health systems in West Michigan. So Spectrum, of course, Metro, and Mercy Health. But then all of the health departments, obviously Kent County has been a huge partner with us in this, Ottawa County, Allegan County, Berrien County, and I'm missing some of them obviously, but all the health departments and health systems have come together essentially, and we're essentially taking our badge, we're putting it down on the table, and we're saying, hey, can we really coordinate our services better so that we're not confusing patients, so that we're not fighting over patients, and so we're doing a lot of collaborative effort to get this vaccine out to you in an efficient manner. We've been meeting for about 8 weeks now. and have a ton of collaborative efforts that we're taking on. One of which is on this slide, which I can show you. So if you saw Brian Hartle's kind of racial ethnic disparity slide there, where this disease really affects that Black and Latino population at higher rates and at more deadly rates, which is alarming to us, right? And so we can't just vaccinate the people who have the iPhones, who can set up through MyChart, or who have cars or access to great healthcare because they have great insurance, right? We've got to really find those vulnerable populations. And so I'm really happy to report that in partnership with the Kent County Health Department, we are having community kind of mobile clinics where we're going out into these communities where maybe people don't have the means to do certain things that a lot of us have to do. So at New Hope Baptist Church and Wyoming Senior Center are the first two that are going live very soon this week, where again, we're going to be out into the community and giving vaccines. So really excited about that partnership as well. And that's just the start. We're going to have more partnerships throughout the West Michigan Vaccinate collaborative that we're working towards. Second thing I want to say about the Vaccinate West Michigan collaborative is this, and it's our website. So vaccinatewestmi.com. That basically is your website for all of your vaccine needs. It's going to have everything from what the vaccine is, the different types, the doses, to I think what everybody really wants to know is the rollout and the distribution of that. And that's what we're really excited about. So vaccinatewestmichigan.com. Next slide, please. Okay, so the big question is, and this is my last slide, and then we're going to get to your questions. The big question, though, is, well, how do I sign up? And there really are two options. The first option is that you can sign up individually through your health department or your preferred health system. Let's just say you're a Metro patient and you want to sign up through Metro. You can certainly do that through your normal means, or again, you can go to the vaccinatewestmi.com and sign up there. We have all the links to every single health department and health system who's part of our collaborative. We have all of our links there where you can sign up individually for a vaccine. That's the first thing. The second thing is, for those that are in that 1B category, remember 1B are those essential workers like childcare and schools, police officers. You could sign up your business utilizing a survey. And this survey, basically, it asks you questions like, what type of business are you? How many employees do you have? Et cetera. Where are you located? Et cetera. That survey basically is going to be basically put out by all the health departments, and then we're going to eventually put it on our vaccinatewestmi.com. So that gives you peace of mind that at least you're on a list, right? You have signed up your business on a list. The one thing I want to kind of stress to everybody, though, is this: we just got to be careful with vaccine shopping, which just means that, let's say you sign up for a vaccine at Spectrum, and it's not until 2 weeks from now, but then you get it through Ottawa County Health Department tomorrow, and then you forget to tell us that I already got my vaccine, and you don't show up for your appointment at Spectrum. And the problem with that is we really have a limited amount of doses, right? And as they come in, we then allocate each dose to an individual person. And so just think about others. Think about others going through this kind of vaccine process. If you have a spot reserved at one of our health systems, just keep that spot. You got your vaccine, just keep that spot, be patient. Don't try and do a lot of vaccine shopping to get it in a little bit sooner. So that's the last thing I'm going to say. Again, very exciting. This finally is the light at the end of the tunnel. And I'm so happy that we are here working through this collaborative. This won't happen anywhere except in West Michigan, by the way. It just shows you, you think about all the things that West Michigan has went through and how you guys have listened to us. You saw on Brian Hartle's slide there, we thought we were expecting big things after the holidays. And we put out messaging, please stay home, make your close groups tighter, right? Because we were really in that surge, and you guys listened. And again, I give you all credit and a big thank you from myself at Spectrum Health, and then also from the Kent County Health Department, and really the Vaccinate West Michigan Collaborative. So thank you for that. And now we're here with Vaccine, and hopefully we can get back to doing our normal business operations very, very soon. So with that, Lisa, I'll turn it back over to you for questions.
So I echo the thank you, because it truly was everybody doing their part that allowed us to do what we're doing today.
Absolutely.
So we have a lot of questions coming through, and we'll try to get through all of them. The first one I'm going to go to is, if an employee has side effects consistent with COVID after receiving the COVID vaccine, should the employee be isolated? Dr. Lopez, would that be you?
Yeah, it's a great question. And really the answer I have is kind of referencing that image from before. So it's not known yet how long your protection will be, and then more specifically, whether an individual person actually develops antibodies towards the spike proteins or towards the disease. So from an isolation standpoint, the answer is yes. You still want to make sure that you follow the practices that we have, because we don't have that information yet. But the vaccine is a very strong protector towards the long-term health effects towards an individual. So in short, yes, they should still follow best practices.
All right. I think this sort of builds in the same one, as if a person has gone through both doses of the vaccine, do they need to quarantine still if they are exposed to a COVID positive person?
Yeah, I'll take that one as well. So the protection, that's great on an individual level, but one of the things that's still being studied is whether or not you can be a carrier. So I'll use the example of strep throat. There's lots of people in schools who, unfortunately, kids included and teachers, but they get sore throats or infections every year. In addition, there's people who have no symptoms but actually carry strep and can pass it to other people through sharing cups or different sources. So with COVID, what we're trying to learn is, can an individual be protected but still carry that infection and give it to someone else? So that has not yet been answered. And so from the standpoint of protecting others, we would definitely want everyone to follow best practices.
Great. Thank you, Dr. Lopez. Brian, this is for you. What is the correct procedure for small companies if an employee tests positive? What should the company do with all working employees that have had contact with him or her?
Yeah, so we really determined the infectious period for an individual to be 2 days prior to the onset of the symptoms, or 2 days prior to the test date if they are asymptomatic. And anyone who has close contact with that individual during that infectious period, so that's 15 minutes or more within a 6-foot space, it can be cumulative over the course of a day. Those individuals should be quarantined for, now it's 10 days from the last date of contact with that positive case during their infectious period. But the health department can help you if you have questions about that. Like I said, we have a team that's dedicated to working with employers to help in that contact tracing, to identify those who are most at risk for exposure. Sometimes, employers kind of cast their net too wide and maybe have people quarantined who shouldn't be. So we can always be a resource to say who should actually be quarantined in those situations.
That's great. Thank you. Keith, I think this is for you. How are you reaching out to schedule seniors who may not see your alert emails about self-scheduling? You talked a little bit about going out into the community. Can you share a little bit more on that?
Yeah, big concern. All the health departments and health systems are working on having kind of phone lines, if you will, where they can have family members who will essentially could call on their behalf, or they could call themselves. We realize that there's always technology issues, sometimes in the older population, where they don't know how to use an iPhone or don't know how to download apps, that sort of thing. Something that we are certainly very cautious of and need to get to those most vulnerable populations. So that's the first thing. Second thing is, I talked about the mobile pop-up clinics. We're going to be going out into communities. We're going to be really start organizing over the next 2 or 3 weeks how we do that. What kind of equipment do we need, et cetera. But that's what we have going on, hopefully to serve our elderly population.
Great. Dr. Lopez, this is for you. Has there been any COVID-related death in individuals after they have been vaccinated? And is it recommended for individuals with autoimmune disease? I might build on that too, maybe to cover those that is not for.
Yeah. So at this time, there has not been any deaths. So from the standpoint of, in the United States, we have the Pfizer and Moderna vaccine. And if we reference that other image, you did see that there were side effects or reactions, and they were green and blue. What you didn't see was red. So really the severe reaction that was potentially unanticipated. And so really this has been given to millions of people across the world, and really has been a very safe and effective vaccine. Regarding actually who shouldn't get the disease, and I'll answer the question about the autoimmune, really this is a safe vaccine for lots of people. Now, each individual person has their own health profile, and so if you do have concerns, you should touch base with your provider. But the biggest piece that has not been studied are for individuals who are pregnant. So for women who are having that debate or question, that again should be a discussion with your OB-GYN. But the main probably barrier that a lot of people are used to are thinking about, well, I'm allergic to eggs or X, Y, and Z, and that's not the case. So from an allergy profile standpoint, this is a better vaccine than others.
That's great. Keith, I believe this is for you. Will businesses that qualify as 1C be able to sign up after 1B?
Yeah, the short answer is yes. Every phase we kind of have taken different approaches just because of how fluid things have been. But our goal is to really have almost that one source of truth, which again is that vaccinatewestmi.com, where then you can sign up through a survey that's definitely live now for 1B, and then we hope to have it for 1C as well.
So Dr. Lopez, do we know how long the vaccine will last once received, or how often we'll need to be vaccinated?
Yeah, that's a great question. And so as we get more data on the different vaccines, I know I only mentioned the Pfizer, Moderna, but there's a lot of promise in some of the other ones that are coming down the pipeline. So one of the things I'll say that I read just yesterday is the Moderna vaccine is believed to have very long protection. So whether or not that's multiple years, that's still to be seen. Really, if we measure how long we've been in this pandemic, it's months. And granted, you can round up and say just over a year. But from the standpoint of saying what we know today is going to be different than what we know in the future. So what we have proof from the FDA standpoint is that the Pfizer and Moderna vaccine are effective after 2 doses, and so really that's the important thing to know. A lot of people are saying, well, can I skip the second dose if I want to avoid those side effects? And it's strongly discouraged to do that. You should get both doses because that's really where the science is today.
Great. So Keith, this is more about like how businesses sign up. So should a business of 50 or less employees sign up as a company, or maybe like what are the parameters that a company might want to think about signing up as a business?
Yep.
And where would the vaccine be administered?
Yeah, 2 great questions. So to the first question, remember there are 2 ways you can sign up. One is that you can sign up individually through your health department, or if it's a health system, through your MyChart process. So those are people who typically are associated with either Spectrum Health, Metro, et cetera, have a MyChart account, and that's how you could sign up essentially for vaccine. So that's how you do it individually. For a business, though, who believes that they are 1B and they believe that they should be getting vaccinated before others, then yes, I would absolutely sign them up as a business. What we do at that point is we take the survey and it kind of data dumps to us, and then we as a collaborative, we start looking at each of the businesses and we start saying, okay, this business is in Ottawa County, for example, we'll have the Ottawa County Health Department do it. Or this business is in, let's say, Berrien County, and in this county, Spectrum Health Lakeland is going to actually take care of this business. So we actually meet every single week, and we are starting to divide up who has what company, essentially. That's how it really is going to work.
We also have a request to repeat the website for Vaccination West Michigan.
Yep, vaccinatewestmi.com. You can see it scrolling there at the bottom.
Okay. So this is around requiring or not requiring as an employer. So what is the downside if employers do require or don't require vaccines?
Yeah, maybe I'll take that first, then I'll pass it over to my colleagues here. So I think what we have tried to do, even with our own employees at Spectrum, is we've tried to really rely on the evidence. So the evidence, again, suggests that even though this was like an emergency, an EUA, emergency use authorization, the evidence still is overwhelming that vaccines are certainly safe. And Joel went through all those details, which I'm glad he did. And therefore, really, to mandate it, does it even, do you have to mandate it? Because the evidence is overwhelming. We really want to educate our patients, get them educated, allow them to make their own decision. But we think and we hope that if they're hearing Dr. Lopez and Brian here, that it's a no-brainer that you would get vaccinated. Now, if our friends over at one of our law firms are on our webinar today, what they would say is that by law, you could mandate the vaccine. You can actually mandate the vaccine by law. I think most businesses that we've talked to, though, have decided not to mandate it, but again, to rely on what we've been saying, which is the evidence is overwhelming that they really are encouraging their employees, but allowing them to make their own decision. I'll pass over to Joel and Brian and see if they have any other comments.
Yeah, my comment is beyond just the workplace and just thinking as a society. So, this is a tough pandemic on a workplace standpoint, on an individual standpoint, and we have an opportunity to do the offensive attack well. And the longer that we wait is really going to put us at risk for not having vaccines that work. So what I mean by that is, if you've read in the news or you've seen different articles, and even what Brian commented on, there's modifications, or the virus is getting smarter. And so, today we have a chance to win, but if we wait decades to really try to then take this seriously, whether that be on an individual level or on a community level, our vaccines might not work. And so really the part that makes it almost more of a personal question is, do you want to make this go away? And I think the answer is easily yes for people.
Yeah, Brian, anything to add?
No, I don't have anything else we can move on to if there's more questions.
Well, I'm going to, before we go on with more questions, just want to do a shout out to the team here, especially because we're getting a shout out for the vaccination process on 68th Street Clinic. It's very slick, efficient, and very patient focused and friendly. Thanks for that. Mm-hmm. Congratulations. Yep. We have one here regarding TB. So we require TB for pre-employment. The CDC recommends waiting 4 weeks. Any other health? Oh, sorry. I see that I just blinked out there. So this is around we require TB for pre-employment. The CDC recommends waiting 4 weeks after second dose for TB. Are there any other healthcare or clinical recommendations or precautions for employers after the second dose?
Yeah, I can take this one.
Yep.
So, from a TB screening standpoint, there's different ways to do this. So you're correct about making sure that you space a COVID vaccine and a PPD test or that injection underneath the skin. And that injection under the skin, again, is testing for tuberculosis. So from a recommendation standpoint, yes, you do want to keep the two of them separate. But really what I would like to offer, kind of make sure you guys are aware of, there's another way to screen for tuberculosis, which doesn't have any timeline effect, and that's a blood draw, which is then the quantiferin gold. So obviously each employer might have needs where, yes, they understand the importance of quantiferin gold, but they're required through some other rules to do a PPD test or even a 2-series PPD test. So the science, yes, is that they need the COVID vaccine and the PPD need to be separated, but there are other options.
That's great. Okay, I think I'm just doing a quick time check here. We're at 9:58. So we're going to take one last question and then we will close. So the last one is, do we direct employees to sign up for the COVID-19 vaccine in the county they work in or live in, or does it matter?
Good question. We talked a lot about this through our COVID vaccine collaborative. What we've said is, for the most part, it's where you live in. But having said that, we really are not. So, for example, if someone comes to Kent County from Ottawa County to get vaccinated. It's not like we're checking them and saying, "Oh, you don't live in Kent County, we're gonna send you home," right? Like the goal is to get as many vaccines in arms as possible and as quick as possible. But for the most part, the rule is it's where you live. If you live in a certain, then if you live in Ottawa County, for example, look at the Ottawa County Health Department website. Look at maybe Spectrum Health Lakeland as an example. Or, I'm sorry, Spectrum Health Zealand as an example. So start there first before you go out to others. Hope that makes sense.
Great, thank you. And again, thank you to each of you for being here and sharing this great information for all of us. We appreciate it. Just a reminder, this has been recorded, and you can find the recording on spectrumhealth.org/ let's have two things here. This recording will be on our LinkedIn page for Spectrum Health, our company page. And also we will have it on our employer resources page, which is at spectrumhealth.org/employer resources. Thank you again for joining, everyone.
Thank you all.
Bye. Thank you.